growing pains. Mental health and Mississippi's children.
Mental health, because of the stigma, because of some of the, they're unclear about what to do, how to access, all the issues, the barriers, we tend to steer away from it.
I feel like if I'm a family who knows resources and find myself struggling, people who don't know resources have to truly be struggling.
They don't know who to turn to, pediatricians, those kind of people do not have the information they need.
And now, Melissa Faith Payne.
Access to mental health care is a problem for Mississippi families. Today I have Joy Hogue, Executive Director of Families as Allies, John Damon, CEO of Mississippi Children's Home Services, and Nikki Flippins, parent of 4 whose children have received mental health treatment. Thank you guys so much for being here today.
Thank you.
Dr. Hogue, I want to start with you. Talk to me about Families as Allies and a little bit about what you guys do.
Okay. We're the only statewide organization run by and for families of children who have mental health challenges. And our mission is for families to be partners in their children's care, either for their individual children or for us to work together at the systems level to make sure systems and services in Mississippi really are responsive to what our children need.
What are some of the things that you guys do?
We spend a lot of time on the phone. Any parent can call us or caregiver, and we help find resources. We're a listening ear. We help people understand what the laws are regarding children's rights in different systems and how they can access services. And then I may have already said this, we go to a lot of meetings with families, often at schools, and then we work on different policy councils and with different legislation and things like that to make sure that when those things are being developed, it really does include the family voice.
Okay. Dr. Damon, Mississippi Children's Home Services provides mental health services for families. Talk a little bit about what you guys do and how you provide those services here in the state.
So we're a statewide private nonprofit organization that kind of provides a full array of behavioral health, educational, and social services. We have found with most of the kids that enter into our care that receive mental health services, you've got to also come alongside them with respect to educational services, social services, support for the families. So we have everything that ranges from psychiatric residential treatment that's more intense, all the way to adoption and foster care, shelter care, therapeutic foster care, group home care. And for every kid that we're serving in a residential kind of setting, we have 12 kids that we're serving in their own home and community. We're in all 82 counties going into the home, working with children and families in their home and in their community.
Now, Nikki, you have 4 children at home. Talk to me about your children and talk about your family.
I have 4 children, 6, 12, 14, and 15. I do have 2 children who have received ongoing services since a very young age for mental health, emotional behavioral issues, and we receive services from various agencies and in various types, anything from acute to residential services to family therapy, individual therapy for both of those children. So right now we're still struggling with a lot of different issues, just trying to make sure that they can get all of the services that they need in order to be successful as adults.
Have you had a hard time finding how to get in touch with those healthcare providers?
Well, I'm actually a social worker, and so I've worked in the field for a long time, so I know a lot of resources. Even though I feel like I know a lot of resources, or I know a lot of people who know resources that I don't, sometimes I still feel like there are gaps. So sometimes in my work currently, I feel that myself and some of the other families are struggling, because I feel like if I'm a family who knows resources and find myself struggling, people who don't know resources have to truly be struggling. So right now, I do find that there are still, there are some things that are in place that have been a help and have helped us move to a different level. I still feel like there are some services that would be beneficial that would help us move even to a better place.
Like what? What are some of those services?
One of the things is that I think we need true respite services. Respite services meaning that like a therapeutic place that a child can go so the parent can have that mental health break for themselves. There are some agencies who, depending on the situation, offer some type of respite services, but they're not always people who are trained to really understand the behaviors that the child may present, or they may ask that you locate other family or friends that they can also use as respite. But oftentimes, if you have a child who has gotten to be 12, 14, 15 years old, the family and the friends are tired too.
Right.
So sometimes that's not always an option. Sometimes you need someone outside of that pool that you've used for so many years. Another thing is that I found that I thought would be helpful for me would be if there was some type of crisis placement, not necessarily an acute placement for a child to go into, but sometimes things happen in a home where the parent and the child may just need a day or two of just separation, where we can say, if you have one child who maybe has violently attacked another one of your children, or one child who maybe has sexually perpetrated on another child in a home, then in order to move forward, even if that child is able to stay in the home long term, the parent and the child may just need a day or two of separation just to give everybody a cool down time. And those may not always be opportunities for you to use family and friends either. It may be that it just needs to be someplace where people are trained and they understand the needs of the child while the family and the child is separated.
Children in Mississippi who have severe mental illnesses and come from low-income households can receive home treatment through a Medicaid program called MyPAC. MyPAC not only provides treatment services for the child, but support for the family at home as an alternative to treatment in a psychiatric facility. Mental health providers who offer MyPAC services include Mississippi Children's Home Service, Pine Belt Mental Health Care, and Youth Villages.
Can you talk a little bit about MyPAC and the services that they provide, and could that even be beneficial in any of the instances that she mentioned?
The intention of MyPAC was to answer the question, could we provide in a home the same services that were provided in a traditional residential treatment center, in a psychiatric residential treatment facility? And so really the premise was take the mental health professionals that you would typically wrap services around in a residential setting and take those into the home and make them available 24 hours a day, 7 days a week, whenever a crisis emerges, whenever there's a need for counseling. Maybe the child has counseling in this room while mom's getting support over in this room, or talking about how to have a homework plan or grocery list or whatever it is. But you bring to bear all the resources from the professional side that you can, as well as non-traditional services and support services from, support systems in the community. So whether that's a coach, a teacher, a friend, an aunt, a grandmother, whoever in the family that's important to that child and family, that's a support system for them, and you wrap those services around them 24 hours a day, 7 days a week when they need it, and you keep them out of a residential setting.
So we're talking about MyPAC, and when we're talking about that, right now it's currently available for families who have Medicaid, but Dr. Hogue, is it available for families who don't?
No. That would typically be paid for by private insurance, and in Mississippi that doesn't happen. And I'm not aware that families could pay for that out of pocket. I don't know if that ever comes up.
Is that an option?
It's never happened.
Yeah.
It's never happened, but
Yeah.
it would certainly be an option.
Yeah.
The service is there. The mechanism, as you were saying,
Right.
in the private insurance world has not been.
Right. So we do need to work with that. And I will also say this about one thing we've observed about MyPAC. I think something very good happened here. You have this parent who knows what the real world is like, knows what she really needs, knows her children better than
Right.
anyone, who's saying, these are some things that would work better for us. And I think MyPAC has offered a lot of help to a lot of children and families. And I'll say this because I'm a psychologist. I think one thing that happens anytime a mental health program begins, no matter how well intended, that sometimes it relies too much on the traditional mental health services. And if we've had feedback from families about, that's one thing that sometimes happens with MyPAC. And the more it can be individualized to what that family's saying they need, and not necessarily seen as this is what this family needs to fix, but this is the support this family needs, and they know their children better than anyone, then those kinds of very good things happen.
Do you have to qualify for this program? Does your child have to be seriously mentally ill? How do you even become a part of
Yeah,
the
great
program?
question. So remember, the MyPAC program is the same level of care from Medicaid's perspective as psychiatric residential treatment.
Right.
So to access that service, you have to have an independent evaluation, psychologist, psychiatrist, to determine the need for that level of care. And then once it's submitted to Medicaid, they have their own review organization that has to, from another independent physician who has to say, yes, this service is medically necessary for the child. So you have two independent physicians who have to say that this is the necessary service. And then that service, again, could be provided in a residential context or in the home.
Well, Dr. Hogue, let me ask you, what happens if you're doing everything but you're not approved? Then what happens? What happens to those children and those families?
Well, a lot of times that child's rehospitalized because there's not the support, or they end up in some other setting because their families are doing everything they can, but there's just not enough support to keep them in the home safely. And sometimes they'll end up back in the hospital. They'll often get kicked out of school. They may even end up in the juvenile justice system just because they're acting out and there's nothing there.
A lot of private providers who provide individual and family therapy don't accept Medicaid. So if you have a child who might qualify, that you may want to see if they qualify for MyPAC, and if they don't, then oftentimes you find that there are very limited number of therapists who will accept Medicaid, and even those that do have long list, a waiting list to even, so if you have to wait 3 to 6 months to get the child even seen, then all of that time, the burden is just on the parent to maintain. I had one of my children who I wanted to see a particular therapist who only took a limited number of Medicaid clients, and we eventually found a different resource, which I think is going to be successful. But originally, we had already been on the waiting list for about 4 or 5 months, just waiting to find a Medicaid provider. And oftentimes, you find children who end up in acute and maybe even end up going on to other services like residential who may not necessarily need it, or maybe even kids who we want to somehow qualify for MyPAC because that's the only option that we can find.
So let me get this straight. With MyPAC, if you have Medicaid, you can qualify for MyPAC, but if you have private insurance, you can't. And then there's some mental health providers who will not accept Medicaid. Is that right?
Right.
So then what happens if you're just kind of in limbo there?
It is difficult. It is, I have great compassion and sympathy. And you mentioned this at the front. You have a background in social work. She has a context to hang this. She has relational connections around the state and knows who to call or knows to contact. And it was still and is a great challenge. There is no clear, no wrong door right now for families. And that's not okay. We must press for a very clear door for families to enter, to be assessed for what the needs are, and to quickly connect them to the right service at the right time, the right dose, and the right frequency so that they get the services they need where and when they need it so they can get back to their life.
When you're saying it needs to be pressed, who needs to be pressed?
We're having the right discussions within the context of mental health. We need to bring in education and health care and all the various systems, insurance providers, so that there is a clear and cohesive and collaborative process.
I want to ask you who needs to be pressed. You're
Well,
ready.
I'm very ready for that discussion. And I will say, and this is an indictment on our system and on our state and on all of us as citizens, that when we look at our calls, and this goes along with what John is saying, most of the people who call us have never ever access the formal mental health system. They don't even know it exists. I don't know if that's an indictment or not, but I say, as an advocate, I feel that way. But they're still having significant struggles with their children, and they're having them in the schools. They don't know who to turn to, pediatricians. Those kind of people do not have the information they need. So we need to take, and I'm agreeing with John, we need to take a big, it's like a step backwards and look at where do those services really need to be. And those services need to be out there where the children really are in ways that their families truly can access. And that's in places like the health department, in schools, and in a way that's friendly to those systems. I will also say that we have in our state law, we have a system, and it needs, and John and I have had this discussion many times, it needs to be expanded, but we have a system of care for children's mental health that brings a number of those players to the table: health, Medicaid, education, to coordinate those services and have a true system of care for children's mental health instead of a mental health system where they get the services where they really need. The group that oversees that hasn't even met since 2012. The leadership in our state needs to make a commitment to do what we need to do and come together for these children, start with what we have, make it better, and really coordinate our system of care.
Well, why are these children not getting the help that they need?
Well, they're falling through the cracks, and it's because that system of care out there is not coordinated. It's much more likely that a pediatrician or a teacher is going to be the first person to encounter a child who needs some sort of mental health support. So they need to be able to recognize it, and they don't have the support they need right now to do that, and they won't until we have all of those systems coordinated. I think we also need to look that I believe I'm right on this, every major system in our state, child welfare, mental health, education, juvenile justice, has either just had some sort of legal action, is facing some legal action, or is in the middle of some legal action for failing to serve the needs of some group of children. And when you look at those groups of children, just like John said, the common factor is typically that they have mental health challenges that haven't been met. It's a huge issue.
Well, looking closer to home, is there a stigma that's involved in getting mental services for your child?
Yes, and I think that's because instead of seeing it in the context of health, that mental health is just part of health, and just like you can have a physical problem such as diabetes, people don't say, ooh, your child has diabetes,
Right.
What did you do wrong? That this is just one more of those things, and it's okay to ask for help, and it's okay to say, I think maybe a little something's wrong, or I think a big something's wrong, but I want to get some help, and to be able to have a place where you can go and get that assessed.
Do you think that there are two different health systems for those who need serious mental health treatment and those maybe who just need a few services?
It's harder to find when you have a child with serious mental health issues.
And part of that, what I hope we can do is where we've created unnecessarily dichotomy around serious and not, that we really look at it as everybody's on a continuum.
Yeah.
I mean, when you talk about 1 in 5, and to put that in context, if we were to change the topic and we were to say 1 in 5 children have cancer and 80% of those do not receive treatment, we would have an uprise. We would say that's not acceptable as a community. And we would say every kid who has cancer needs to get treatment. We would all agree on that. And yet with mental health, because of the stigma, because of some of the, they're unclear about what to do, how to access, all the issues, the barriers, we tend to steer away from it. And so it's going to take leaders to talk, to have discussion. The First Lady and I went around the state and had dinners with community leaders all around the state to do nothing but to say, you're the leaders in this community. And mental health is critical for our state on all levels. It's going to take people being more vocal. It's going to take mental health awareness days and us to realize that it doesn't sit over here in a silo. It's a problem for every family. Everybody faces this. And together, if we raise the level, decrease the stigma, then it can be something we talk about like diabetes. Because it used to be a day when if you had diabetes, parents didn't want to talk about it. They were embarrassed. They didn't understand it. They didn't want to talk about having an insulin pump. So there was a stigma even around that. And you fast forward that today, now people go, hey, my child has diabetes, and everybody goes, okay, what do we do to help?
Right.
We need to have that same parallel process happen with mental health. Hey, my child has depression. My child has anxiety. My child has attention deficit. And everybody go, what do we do to rally to help you?
Right, and stop blaming parents. Because there's all of us as parents could do a better job. And that's true with any parent. And also when your child has a disability, you end up being on display more, so it's a lot easier to look at a parent of a child who has a mental health challenge and think, oh, you should have done that different. Well, that's not why the child has mental health problems. So to stop blaming parents so that they can be part of that conversation, both at the individual level and at the systems level. And one thing with one of the potential lawsuits that's going on in the state right now, there was an independent assessment done of these very things, and, looking at all the systems and what needs to happen to make our state more responsive to the needs of children with mental health challenges. And that included all the stakeholders, including families. Right now, that's not even public information. So the more we can have those kinds of conversations, have that kind of information out there so that we can all look at it and figure out what needs to happen next to really help our children.
Well, let me ask you this, because we're talking about not blaming the parents, but what about those environmental issues and those instances where there's something that's happened in the home that may have triggered something or led to something?
Right, that is very true. When there's early childhood experiences that are traumatic, it can affect a child for a long time and lead to a lot of different challenges, including with their health.
Right.
I think one thing to think about is most parents, even when those difficult things happen, still want the best for their child. So even if they need a lot of extra support, even if that child needs to come out of the home and maybe stay with someone else while that parent gets whatever they need together with the right kinds of supports, that's still usually, almost always, the best thing for that child is to be back with that family. So to see it more as an issue of, yes, absolutely, we have to address those issues, but it's usually not about someone being a bad parent. It's usually about someone being stressed out or not having the resources they need, and they can with the right kind of support.
Well, we're talking about stigma. You do have 2 children who have mental health issues. How are those children coping? And you as a mom, how are you coping?
We have our good days and bad days, and throughout the years, I've run into a lot of the issues like what Joey was talking about with the shame and blame, and in different systems where you do feel like you're on attack, you're under attack because other people feel like maybe you're not doing the job you should, or you're not doing it as well as you should. And I try to tell people all the time, I want my child to be successful. I want them to be happy. And this is not a prayer that anybody has. I mean, nobody anywhere is, giving birth to a child and thinking, ooh, I hope this child doesn't walk, or I hope my child can't talk, or, any more than a person is saying, well, I hope my child has behavior issues and the school calls me every day, which happens a lot when you have children who have behavior issues, or I hope that, my child is so disruptive at his grandmother's house that he's not allowed to go there. So these are not things that parents are wanting and desiring. And we all want something better for our children. And we want people to be, provide some advice or some support if it can be constructive criticism, but to be demeaned and feel more isolated makes it a lot more difficult. I even had a man tell me one day, well, if I had prayed hard enough, my child would be different. And I felt, had I not been in the mindset that I am, a different person, could have taken that very harshly. And, I just basically told him, when we look at physical health, we don't tell people that. We don't tell people who have cancer that you can't get treatment and pray at the same time. So it shouldn't be that I can't get mental health services for my child and still be prayerful about there's going to be a life-changing event and we can see something different. And we shouldn't have to separate that, and I shouldn't have to feel like I'm a bad parent because we're having to deal with those issues.
And I want to end right there. And I want to thank you guys so much for being here and for being a part of this dialogue.
Thank you for covering.
All episodes in this series on mental illness in children are available on the PBS video app and on the MPB YouTube channel. Go to mpbonline.org for web extras and more discussion about children's mental health. For all of us here at Southern Remedy, thanks for watching.
Southern Remedy is underwritten by a grant from the University of Mississippi Medical Center.